HIV/AIDS is a major global health issue. It has affected millions of people around the world. The virus attacks the body's immune system, making it hard to fight off infections. HIV stands for human immunodeficiency virus, while AIDS stands for acquired immunodeficiency syndrome. AIDS is the late stage of HIV infection. The fight against HIV/AIDS has made progress over the years. New treatments help people live longer, healthier lives. However, there is still work to be done. We need to continue to raise awareness about HIV/AIDS and support research for a cure. HIV, or human immunodeficiency virus, is a virus that specifically targets and attacks the immune system, which is our body's natural defense against illness and infections. The immune system is a complex network of cells, tissues, and organs that work together to protect the body. It identifies and destroys harmful invaders like bacteria, viruses, and other pathogens. Central to this defense system are white blood cells, which play a crucial role in identifying and eliminating these threats. Among these white blood cells are special cells known as CD4 cells. HIV specifically targets and invades CD4 cells, which are a type of white blood cell. These cells are also commonly referred to as T cells. T cells are essential for orchestrating the immune response. They signal other cells in the immune system to perform their functions, making them vital for maintaining a healthy immune system. Without a sufficient number of T cells, the immune system cannot function properly, leaving the body vulnerable to a wide range of infections and diseases. When HIV enters the body, it seeks out CD4 cells and takes over their machinery to replicate itself. This process involves the virus inserting its genetic material into the CD4 cells, effectively hijacking them to produce more copies of the virus. As HIV replicates, it damages and eventually destroys the CD4 cells. This destruction of CD4 cells is a gradual process, but over time, it significantly depletes the number of these critical cells in the body. As the number of CD4 cells decreases, the immune system becomes increasingly weakened. This compromised state makes it difficult for the body to fight off infections and diseases, leading to a higher susceptibility to illnesses that a healthy immune system would typically be able to fend off. Fortunately, with advancements in medical science, there are treatments available such as antiretroviral therapy, ART, which can help manage HIV infection. ART works by reducing the viral load in the body, allowing the immune system to recover and function more effectively. Alongside medical treatment, maintaining a healthy lifestyle and having access to support systems are crucial for individuals living with HIV. With proper care and management, people with HIV can lead long, healthy lives. HIV is transmitted through certain body fluids. These fluids include blood, semen, vaginal fluids, rectal fluids, and breast milk. The virus must enter the bloodstream to infect someone. The most common ways HIV is spread are through sexual contact, sharing needles, and mother-to-child transmission during pregnancy, childbirth, or breastfeeding. It's important to remember that HIV does not spread through casual contact. You cannot get HIV from hugging, kissing, sharing utensils, or using the same toilet as someone who is infected. Preventing HIV transmission is crucial. It is a vital step in ensuring the health and well-being of individuals and communities. By understanding and implementing effective prevention strategies, we can significantly reduce the spread of HIV and protect ourselves and our loved ones. There are several effective ways to protect yourself and others from HIV. These methods include practicing safe sex, using preventive medications, and getting regular health checkups. Each method plays a crucial role in reducing the risk of HIV transmission and promoting overall health. Abstinence, or choosing not to engage in sexual activity, is the most effective way to prevent HIV and other sexually transmitted infections. It eliminates the risk of transmission entirely. For those who choose to be sexually active, it is important to have open and honest conversations with partners about sexual health and HIV prevention. Using condoms correctly every time you have sex can significantly reduce the risk of HIV transmission. Condoms act as a barrier that prevents the exchange of bodily fluids, which is a primary way HIV is transmitted. It is essential to use condoms consistently and correctly to ensure maximum protection. PrEP, or pre-exposure prophylaxis, is a daily medication that can prevent HIV infection in people who are at high risk. When taken consistently, PrEP has been shown to be highly effective in reducing the risk of HIV transmission. It is important for individuals at high risk to consult with healthcare professionals to determine if PrEP is a suitable option for them. PE, or post-exposure prophylaxis, is a medication that can prevent HIV infection after a potential exposure, but it must be taken within 72 hours. PEP is an emergency intervention and is not meant to replace regular preventive measures. If you believe you have been exposed to HIV, it is crucial to seek medical attention immediately to discuss the possibility of starting PEP. Education and awareness are key components in the fight against HIV. By staying informed about the latest prevention methods and understanding the importance of regular testing, individuals can take proactive steps to protect themselves and their communities. Community support and open dialogue about HIV prevention can help reduce stigma and encourage more people to seek the information and care they need. Regular HIV testing is an important part of maintaining sexual health. Knowing your HIV status allows you to make informed decisions about your health and take appropriate actions to prevent transmission. If you test positive, early diagnosis and treatment can improve health outcomes and reduce the risk of transmitting the virus to others. If you test negative, you can continue to take preventive measures to stay HIV-free. Section 5. The importance of HIV testing. Knowing your HIV status is crucial. It allows you to make informed decisions about your health and protect yourself and others. HIV testing is simple and confidential. There are different types of tests available. Some tests provide results in as little as 20 minutes. Early diagnosis and treatment are essential for people living with HIV. Treatment can help manage the virus and prevent it from progressing to AIDS. It is important to talk to your doctor about HIV testing. They can help you determine the best testing options for you. Section 6. Treatment as prevention living with HIV. Thanks to advances in medicine, people living with HIV can now live long and healthy lives. Modern treatments have transformed what was once a fatal diagnosis into a manageable chronic condition. This progress has been made possible through extensive research and the development of effective medications. Antiretroviral therapy, or ART, is a treatment that helps control the virus. By taking ART consistently, individuals can maintain their health and prevent the virus from multiplying. This treatment is crucial for keeping the immune system strong and reducing the risk of HIV-related complications. ART works by reducing the amount of HIV in the body. This reduction is measured by the viral load, which indicates the number of virus particles in a blood sample. A lower viral load means a healthier immune system and a lower chance of transmitting the virus to others. This is called viral suppression. Achieving and maintaining viral suppression is a key goal of HIV treatment. It means that the virus is at such low levels that it cannot be detected by standard blood tests. This not only improves the health of the person living with HIV, but also plays a significant role in preventing the spread of the virus. When someone achieves viral suppression, they are no longer able to transmit HIV to others. This concept is often referred to as undetectable equals sign untransmittable, or U equals sign U. It underscores the importance of regular treatment and adherence to medication. Living with HIV can be challenging, but support is available. Emotional and psychological support is just as important as medical treatment. Many people find comfort and strength in connecting with others who understand their experiences. There are many resources, including support groups and healthcare professionals, who can provide guidance and care. These resources can help individuals navigate the complexities of living with HIV, offering advice on everything from medication management to coping strategies. It's important to remember that HIV is a manageable condition. With the right approach, people living with HIV can lead active, healthy lives. This includes maintaining a balanced diet, exercising regularly, and staying on top of medical appointments. With proper treatment and care, people with HIV can live fulfilling lives. They can pursue their passions, build meaningful relationships, and contribute to their communities. The journey of living with HIV is unique for each person, but with the right support and resources, it is possible to thrive. Section 7. The global fight against HIV/AIDS. The global fight against HIV/AIDS has made significant progress over the years. Organizations like UNAIDS are working tirelessly to end the epidemic. UNAIDS leads the global effort to prevent new HIV infections. They work to ensure access to HIV testing and treatment for all. The goal of UNAIDS is to end AIDS as a public health threat by 2030. To achieve this, they focus on prevention, implementing effective prevention programs, such as condom distribution and PrEP access. Treatment, ensuring that people living with HIV have access to life-saving ART. Section 8. Breaking the stigma, HIV, and society. Stigma and discrimination continue to surround HIV/AIDS. This can prevent people from getting tested, seeking treatment, and disclosing their status. HIV stigma can manifest in many ways. It can lead to social isolation, discrimination in healthcare and employment, and even violence. It's crucial to remember that HIV does not define a person. People living with HIV deserve compassion, understanding, and support. We must work together to break down the stigma surrounding HIV/AIDS. This includes challenging misconceptions and promoting accurate information. Section 9. Join the movement. Get involved. Everyone has a role to play in the fight against HIV/AIDS. You can make a difference by getting tested for HIV and knowing your status, educating yourself and others about HIV prevention and treatment, supporting organizations working to end the epidemic, speaking out against HIV stigma and discrimination. By working together, we can create a world free from HIV/AIDS. Get involved today and be a part of the solution.